What is blood pressure? Blood pressure is a measure of how hard your blood pushes against your arteries as it moves through your body. Blood pressure is traditionally measured using an inflatable cuff around your arm. The cuff is inflated, and the cuff gently tightens on your arm. The air in the cuff is slowly released and a small gauge measures your blood pressure. Blood pressure is recorded as two numbers. Systolic blood pressure, the first number. This number indicates how much pressure your blood is pushing against your artery walls when the heart beats. Diastolic blood pressure, the second number. This number indicates how much pressure your blood is pushing against your artery walls while the heart is resting between beats. Blood pressure includes the following four types. Normal, blood pressure readings of less than 120/80ths of a millimeter Hg are considered in the normal range. Elevated, readings consistently ranging from 120 to 129 systolic and less than 80 mm Hg diastolic are considered elevated. Hypertension stage 1. This stage is characterized by readings ranging from 130 to 139 systolic or 80 to 89 mm Hg diastolic. Hypertension stage 2. This stage is characterized by readings consistently ranging at 140/90ths of a millimeter Hg or higher. High blood pressure, hypertension, is defined as high pressure, tension, in the arteries, which are the vessels that carry blood from the heart to the rest of the body. High blood pressure may not have any symptoms, and so hypertension has been labeled the silent killer. Long-standing high blood pressure can lead to multiple complications including heart attack, kidney disease, or stroke. Symptoms of complicated hypertension, high blood pressure can include dizziness, shortness of breath, headache, blurred vision. Other possible symptoms and signs are nosebleeds, blood in the urine, fatigue, chest pain, a pounding sensation in the neck, chest, or ears. Severe high blood pressure is referred to as malignant hypertension, in which the diastolic, bottom, blood pressure reading is over 140 mm of mercury. Malignant hypertension is a medical emergency and can cause stroke. Symptoms can include nausea, severe headache, blurred vision, dizziness. Some people with malignant hypertension may develop kidney failure. They may experience a decrease in urine output and swelling, edema, most pronounced in the lower legs. Causes of high blood pressure. There are a number of factors that likely work together to cause high blood pressure. A family history of high blood pressure can make you more likely to develop the condition, so genetics likely plays a role. High salt intake, too much salt in the diet, or salt sensitivity occurs in some people, which can lead to hypertension, particularly in the elderly, African Americans, people who are obese, or people with chronic kidney, renal disease. Some people have blood vessels that are stiff and lack elasticity, due to vascular disease. When this affects the tiny arteries, arterioles, the arteriolar stiffness causes increased resistance to the flow of blood and high blood pressure. This is most common in people who are also obese, have a lack of physical activity or exercise, have high salt intake, and are older. Low blood pressure, also called hypotension, is blood pressure low enough that the flow of blood to the organs of the body is inadequate and symptoms and/or signs of low blood flow develop. Low blood pressure that causes an inadequate flow of blood to the body's organs can cause strokes, heart attacks, and kidney failure. The most severe form is shock. Symptoms of low blood pressure can include fainting, syncope, dizziness, a feeling of lightheadedness. Decreased blood flow to the coronary arteries results in symptoms of angina, including chest pain. With low blood pressure, the heart rate may be elevated or irregular. Fast breathing, weakness, fatigue, cold skin, pale skin, confusion, nausea, or vomiting can occur, depending upon the reason for the low blood pressure. Other symptoms can include blurred vision, increased thirst. Shock, in which all major body organs are deprived of oxygen, occurs with severe hypotension. Causes of low blood pressure, hypotension. Low blood pressure has many causes, including a reduction in blood volume due to bleeding or other conditions, heart diseases such as heart attack or heart failure, and certain medications. Shock is a condition characterized by severely low blood pressure. This is often a result of septicemia, bacterial infection of the bloodstream. Dehydration due to vomiting, diarrhea, or excessive sweating causes a loss of body fluid and can lead to low blood pressure. Blood pressure also tends to decrease in pregnancy. Now, allow me to offer up some good news. You can manage hypertension and lower your blood pressure numbers through a bunch of simple and easily doable tips and techniques. These are things you can do each and every day to lower your high blood pressure and drop your risk of dying early. At the very least, try to implement at least a few of these 22 practices into your life for healthier blood vessels, a stronger heart, and live a longer life. 1. Check your blood pressure at home. Scientists at the University of Oxford found that people with hypertension who checked themselves at home, and had support from medical professionals outside the home, were able to reduce it by a significant 3.2 millimeters of mercury compared to those who relied solely on doctor's appointments. 2. A cup of yogurt each morning. A certain type of beneficial bacteria that lives in our gut can block the effects of high-salt diets, helping to keep blood pressure normal. Yogurt and other foods that contain good bacteria, like kefir, kimchi, and sauerkraut, are called probiotics and can help keep our gut healthy. 3. Sweat in a sauna often. Frequenting a sauna can lower risk of high blood pressure. Researchers reported that people who went in the heat bath 4 to 7 times a week had a 50% lower blood pressure than those who only went once a week. 4. Pick pears and other high-fiber foods. Foods high in fiber like pears, raspberries, black beans, and chickpeas are some of what you should be noshing on every day. The high fiber content helps make us feel full longer so you can more easily maintain a healthy weight, which is key to keeping blood pressure in check. 5. Meditate 2.5 hours a week. Meditation and practicing mindfulness has long been known as a great stress reliever, and the lower your stress, the better your blood pressure numbers. Practicing 2.5 hours of mindfulness behaviors each week, like sitting meditation, body scans, and yoga, can drop blood pressure by around 5 millimeters of mercury. 6. Have a cup of sweet potatoes. Lower salt intake is good for keeping blood pressure normal, but adding potassium-packed foods can also help. These foods, like sweet potatoes, avocados, spinach, beans, deliver more potassium into our system, which has been shown to prompt the kidneys to expel more salt. 7. Cover salads with olive oil. When you put olive oil on vegetables like lettuce, cabbage, and carrots, which are full of nitrites, it makes compounds called nitro-fatty acids. Olive oil has unsaturated fats that make this transformation happen, and those new acids create enzymes that lower blood pressure. And tomatoes, cucumbers, onions, garlic, and olive oil have all been shown to reduce high blood pressure. 8. Have some herbal tea. Drinking 3 cups of herbal teas that contain some hibiscus each day has been found to lower blood pressure. Researchers think that the phytochemicals in the ingredient reduce inflammation in the blood vessels. 9. Sip on some tart cherry juice. Simply drinking some tart Montmorency cherry juice can reduce high blood pressure at a similar amount compared with taking medication. The drop, which was measured at 7 millimeters of mercury lower in the 3 hours after drinking, is more than what's required to reduce risk of stroke by 38%. 10. Crack open a watermelon. Watermelon is full of fiber, vitamins, minerals, and antioxidants, amino acids citrulline and arginine, and in particular a watermelon extract containing 6 grams of the aminos was able to lower blood pressure in healthy adults. Raisins have also been found to lower blood pressure, so mix some into your diet or according to your preference. 11. Mix in cardio and yoga to your workouts and do deadlifts. Doing some yoga and adding in cardio can give your workout routine the extra punch to lower blood pressure. Researchers showed that the combination can also reduce in body mass and cholesterol levels. Doing multi-joint, or hit the weights for 1 hour a week can lower your risk of developing high blood pressure by 17%. You can also add in some aerobic exercise. 12. Put lean beef on your plate. Getting lean cuts of beef every day has been shown to be heart healthy. Go for lean cuts like round roast, top sirloin, and flap steak, and add in plenty of fruits and veggies, too. 13. Stay away from artificial sweets. Fake sweeteners like aspartame and sucralose may raise your risk for developing high blood pressure. 14. Limit overtime. A study on over 10,000 workers that was published in the European Heart Journal showed that working 3 or more hours over a normal 7-hour day increased risk of dying from heart-related problems like high blood pressure by 60%. 15. Relax, get in touch with nature and take a short walk every hour. Learning to relax, laugh, and being happier in general will make you healthier, not just have a stronger cardiovascular system. When you live a happier and more humorous life, your brain releases dopamine and subsequently circulating a compound that lowers blood pressure. Exposing your skin to sunlight is also one way to lower your blood pressure. The rays make levels of nitric oxide in the skin and blood rise, which relaxes blood vessels and lowers blood pressure. Just a 10-minute stroll after sitting can allow your blood vessels to open up and restore blood flow. 16. Drink a glass of beet juice. Downing a cup of beetroot juice every day could drop your blood pressure. The high levels of nitrates work to expand blood vessels, allowing for easier passage and lower pressure. Consuming whey protein may also battle high blood pressure. Drinking low-cost protein beverages every day can drop pressure in those with hypertension. 17. Make a spinach salad. A high body mass index has been linked to high blood pressure. Spinach is high in potassium, which helps clear sodium from your body, and it contains plant compounds that can reduce appetite and curb the cravings for salty foods that led to weight gain. If extra salt can lead to high blood pressure, stiff arteries, and heart disease. 18. Stop consuming energy drinks. Eliminate them from your diet. They usually contain a lot of caffeine and taurine that both can negatively affect blood pressure and heart function. 19. Nosh on dark chocolate. Eating dark chocolate can lower blood pressure in those who already have hypertension. The decadent treat is loaded with heart-healthy cocoa flavanols, or plant compounds, that boost blood vessel functioning. 20. Take advantage of sleeping 4-5 minutes. The study found that daytime sleep of between 45 and 60 minutes long lowered blood pressure readings by a significant amount. You should also check your snoring regularly. It may also be a signal that you suffer from a sleeping disorder like sleep apnea. A single instance of sleep apnea messes up the body's attempt at regulating blood pressure, which can damage blood vessels and contribute to heart disease. 21. Limit smartphone use. The cacophony and attention drain creates more stress and higher blood pressure. Try to set aside a few hours of phone-free time each day, if you have the fortitude. 22. Take an omega-3 supplement. The omega-3 fatty acids are important for heart health. To get enough to reduce high blood pressure, turn to a high-quality fish oil supplement. Most docs recommend up to 1,000 milligrams a day. High blood pressure emergencies. If your blood pressure is 180/120ths of a millimeter of mercury, (mHg), or higher and you have chest pain, back pain, numbness or weakness, or a change in vision, you may be experiencing a hypertensive emergency. These symptoms suggest you may be experiencing what's called end organ damage. End organ damage takes many forms including stroke, heart attack, and kidney failure. Untreated high blood pressure negatively impacts blood vessels in critical areas of the body such as the brain, heart, kidneys, and the aorta, which is the main blood vessel that carries blood away from your heart to the rest of your body. In these cases, it is imperative that you call 911 and go to the emergency room immediately.